Hi folks, here we go with our last two videos of this unit, both focused on arthritis. In this video we'll look at what arthritis is, why it's considered a rheumatic disease, and what that term even means. And we'll also consider we'll look at three of the most common causes of arthritis. And for each of these, try to focus on what goes wrong, what the cause of that is, and then what treatment options are available, because they're going to vary depending upon what form of arthritis we're talking about. So let's move over here and let me get out of the way. So what do we mean by arthritis? Arthritis technically and literally means inflammation of the joint. So, oops, wrong marker, inflammation of the joint. So while that's a kind of a generic symptom, if you will, there are multiple causes to arthritis. Arthritis could be caused by infection, could be caused by old age, could be caused by metabolic disorders, wear and tear, from injury. Could be multiple reasons that joint is inflamed, and we'll look at some of those reasons in this video. But keep in mind again that arthritis is sort of a generic term, kind of like cancer. There are several hundred forms of cancer. There are more than 100 forms of arthritis. But arthritis is referred to as a rheumatic disorder. And whenever you hear rheumatic disorder, that means it's pain and stiffness we associate with the skeleton, muscles, and joints. So arthritis is an example of a rheumatic disorder. Arthritis is a very common condition. Depending on the stats you see, anywhere between 1 in 10 and 1 in 7 Americans have arthritis. So we're talking about millions of people have some form of arthritis. Arthritis is essentially going to be damage to a synovial joint, and in particular it's going to focus on damage to that cartilage or the synovial membrane over time. And if it's not treated, you can have some serious damage, even destroying the cartilage and severely damaging the membrane over time. So again, while there's multiple causes, the basic generic mechanism is damage to that joint, which could be long-term deforming or long-term damage that just simply cannot be fixed. Sorry about that. Some forms of arthritis are, let me give you some terms here that you've no doubt heard before, or some forms are chronic and some forms are acute. Chronic arthritis is going to be arthritis we associate with ongoing, it may be less or maybe more from day to day, but you have this ongoing condition of having arthritis. Other forms of arthritis are more acute. That is, you can go a long time not have any kind of flare-ups or any kind of episodes, and then you can have a quick onset of severe pain or severe inflammation of the joint. So again, even there, arthritis has a range of potential impacts. Again, someone with chronic arthritis is dealing with it all the time. Someone with acute arthritis may actually have long periods where they really have no effect of arthritis at all. Before we go on, then, let's take a look at a normal joint. Some features you associate with a synovial joint. Of course, there's going to be cartilage. That's this white layer here, this articular cartilage around the ends of the bones. We have synovial fluid, this sort of blue or greenish blue in here, produced by the synovial membrane, and then surrounded by this whole joint capsule. You see this kind of white layer here. I'll highlight it. This is the joint capsule. So if all goes well, notice we have this space between the articulating bones. We have this smooth, high-lying cartilage here articulating it, and we have ample fluid. In the event we have different kinds of arthritis, we're going to disrupt this normal joint. So osteoarthritis, as an example, you have here, there's no space. We have the bones rubbing on bones. We're damaging the articular cartilage. That is one form of arthritis. Another form of arthritis is when you have this inflamed, the inflamed joint. Notice how it looks red and hot there. You have extra fluid. The cartilage is intact, but you're also going to have, in this case, the synovial membrane is going to be inflamed by some cause that we'll look at in a moment. Finally, you can have a form of arthritis called gout or gouty arthritis, which is not either of these, but it's an accumulation of these crystals within the joint that causes severe pain, and we'll talk about that in the next video. Before we move on, I just want to mention this. Arthritis is not just an inconvenience. That is, it may be painful, but it can be even deforming. You see here in RA, late stages of RA, you can have even deformity. The joints are pushed and causing these what are called swan neck deformities. So don't think of arthritis as just an inconvenience. It actually can be deforming as well. So before we move on, before we go too much further, let's look at the two basic kinds of arthritis we'll mention in this video, and then we'll cover gout in the next video. RA, rheumatoid arthritis, is a form of arthritis that's chronic. That is, we're going to associate this. I'll come back. How you doing? It's a form of arthritis that is chronic and systemic. That is, it's an inflammatory disorder. It's a disorder we associate with an autoimmune reaction. Why do we even get it? We're not sure. It could be due to viruses and bacteria. It could be due to some other causes. But essentially what happens in the pathophysiology, and let me grab a marker here, is it's an immune reaction in the synovium, in that joint, that ends up attracting neutrophils. Neutrophils, as you may recall, are kinds of white blood cells. They are supposed to show up if there is a potential issue in a part of the body to help fight off infection or fight disease. But when they show up, they release enzymes, and the enzymes, because they release a lot of them, can cause a breakdown of collagen and irritate the synovial lining. It's sort of this snowball effect. When the synovial lining becomes irritated, you can get the synovial inflammation resulting in a pannus. Pannus is going to be, you can think of it as an accumulation of kind of fibrous tissue in that joint. That then causes another reaction which we associate with edema. Edema is going to be swelling. So when we go back and you see that inflamed joint, it's because we've had this snowball effect. Neutrophils release enzymes. The enzymes irritate the lining. The inflammation results in this pannus formation. The pannus formation results in edema. And we go from a normal joint to one that's inflamed and swollen. Again, why did it happen? We're not sure. But it is autoimmune. I had it up here somewhere. No. It is an autoimmune disorder. And like most autoimmune disorders, it's going to be more common in women than men for reasons, again, we don't totally understand. In terms of how it's diagnosed, we will talk about that more in just a moment, but you can see deformities in an x-ray, but most people are not going to have that bad of an arthritis before they're seen by a physician. Since it's an autoimmune disorder, it's going to be essentially an immune reaction. So we actually can do blood tests to detect the presence of these autoantibodies and to determine that someone is experiencing a form of arthritis associated with an autoimmune disorder. So x-rays can be helpful, but they're not going to necessarily always be how you're going to first diagnose this. So for medications and treatment, for RA, you tend to focus on ibuprofen, on steroids, on anti-inflammatories, because as we go back to it again, this inflammation was really the basis of the reaction. So you tend to focus on trying to reduce inflammation and reduce the immune reaction, which will eventually reduce some of the swelling. Moving on. So there are forms of arthritis, though, that can strike kids, and RA is one of them. And once again, we see here it's an autoimmune disorder of unknown cause. It is systemic, and therefore it usually is going to be a condition where it'll also be, and I didn't mention this on the previous slide, but it'll also probably be bilateral. That is, you don't have it just in one finger or just in one ankle. You're going to have this in multiple body parts, usually across the entire body if you have RA. You can have a form of RA that's diagnosed before the age of 16. So again, it's more common in girls, but ages 2 to 5 and 9 to 12. And the good thing about juvenile RA is that the symptoms may actually subside somewhat when a child gets, they move into adult age. It may not, but you can have arthritis younger and then not have it when you're older. But again, I do want to point out this form of arthritis is a condition of arthritis we associate with kids. In contrast, OA is going to be a form of arthritis that we associate more with aging. This is the most common type of arthritis, and it is a chronic form, and it's non-systemic. That is, it's not going to affect the entire body. It's not something that we associate with getting both ankles or both knees or both hands necessarily. You can have osteoarthritis of just your left knee or just your right ankle, so it may not be systemic. The pathophysiology here, kind of how do we get it? Injury could be genetics, could be previous joint damage, obesity and advanced age. These are underlined because these are the two most common causes, are going to cause us to produce the chondrocytes in these joints. They're going to release chemicals. The chemicals are going to cause cartilage degeneration. Now that might seem a little odd. Why would you want to degenerate your cartilage? There's a cycle of breaking down cartilage and building up cartilage that occurs on an ongoing basis. However, if you have these conditions, you may actually have cartilage broken down a little faster than it's being made. If you have advanced age, you've worn down your cartilage perhaps. Sometimes you'll see this referred to as wear and tear arthritis because someone has had a lifetime of wearing on their knees. If you are obese or you have obesity as a factor, you have more stress and more pressure on those joints, and that can cause some wearing. But to go back, these chondrocytes release chemicals. These chemicals are going to cause the cartilage to degenerate. You can have inflammation as a result, and you could even have bone stiffening. A term I'll give you here also is you can have the formation of osteophytes. Osteophyte is a bone spur, and the damage you can have of bone grinding on bone and stimulating extra bone growth and kind of getting in the way of those joints can be caused by osteophytes. A term I mentioned in class already is called crepitus. That's when bone grinds on bone, and that's where you get a lot of associated pain as well. So OA is a different kind of arthritis. This is a wear and tear arthritis. This is a overuse of a joint arthritis, or it could be related to other causes as you see here, injury, genetics, and previous joint damage. So before I go on, let me tell you these things. How do you diagnose OA? A blood test will be worthless because in this case it's not an autoimmune disorder. It's going to be a specific joint disorder. So typically speaking, x-rays will be how you will diagnose osteoarthritis. And for treatment, you want to do pain management, of course, but if the joint is worn out, if the cartilage is so damaged it cannot regenerate, if the bone is starting to grind on bone, if there's lots of osteophytes, usually they have to do surgery and even replace the joint. So now, as we end up, what are some how do you compare RA and OA? This chart's very helpful to think about differences between the two conditions. RA, the onset can be early in life. Like someone could have RA when they are a child. They could have RA when they're 30 years old. OA tends to be a later onset arthritis. That is, it tends to be after you are 40s, 50s, 60s, where you've had some wear and tear on joints and maybe previous injuries. RA is chronic and systemic. That is, it's going to be a whole body disease. It's an autoimmune disorder. So multiple joints are going to be affected. OA will be chronic typically as well, but it's more of a degeneration disease. It's more of a wearing disease. People with RA report usually as the day goes on, they feel a little bit better. Those joints warm up a little bit, they loosen up a little bit, and they will report feeling a little bit better as the day goes on. Someone with OA reports just the opposite. They wake up in the morning and they've not put stress on their joints, but as they do, and their knee becomes more and more painful as the day goes on because now there's more activity with the bone grinding on bone. RA tends to be symmetrical, and you will have the joints tend to be fingers, cervical spine, a lot of times not weight-bearing joints. OA, again, is going to involve the weight-bearing joints because that's where you're going to have the most wearing on the joints. RA tends to have for its symptoms malaise, you just don't feel good, fever and anemia, because again, these are going to be associated with an immune response reaction, OA really has no other signs or symptoms except the fact that that particular joint is very painful. So that's a quick comparison between OA and RA. Hopefully that's helpful. But do again recognize there's different causes, different treatments that you'd want to use depending on what form of arthritis they have. In our last video, we'll look at what happens as our joints age, as well as looking at gout. Thanks.